Body-focused repetitive behaviors are just behaviors that people do that tend to occur over and over and sometimes cause distress or cause some damage. So the examples include hair pulling, skin picking, and nail biting are three of the common ones. We do see these pretty commonly in the general population. It's just something that people don't talk about as much, or they're not aware that there are treatments available for them. Sometimes it seems to be related to anxiety, but actually not always. Sometimes it's a way of soothing that, they kind of like, it feels relaxing to do it. Sometimes people report that they feel like a tingle, like where the hair is that they want to pull out. They feel this tingle and they feel like they have to get that hair, or they notice some dead skin along their cuticle and they really feel like they just have to get rid of it. So the reasons why people do it vary greatly, and that's part of the treatment, is to figure that out so that we can address it. Skin picking can include picking skin from any area of the body. It often occurs around, on people's hands, like around their cuticle area and their fingers. And sometimes people just kind of fiddle with these parts of their skin, but sometimes people actually pick them. And it can get serious if they're picking to the point that it causes an infection. So it's medically recognized because it's something that we have to make sure is not getting to that point that could be harmful for the child or the individual. I have worked with a patient that ended up getting a really serious infection, and the picking was almost down to the bone. And so if the picking is occurring and it seems like it's causing tissue damage, we do have to include the primary care doctor or the pediatrician to make sure that they're not getting an infection and to provide the right treatments to prevent that. Hair pulling could mean that the individual is pulling hair from any part of their body. The most common places are their head and their eyelashes, but it could be any hair. When parents usually want to seek treatment for it is when there's large bald spots on the child's head or all the eyelashes are missing. When we see an individual with hair pulling, one of the things we think about is whether it's automatic or focused. So this occurs with skin picking as well. Automatic hair pulling would be someone who's just, maybe watching TV and they don't really realize they're doing it and they're sort of pulling hair out as they're watching TV. Focused would be that some individuals are really looking for a particular hair. Maybe a hair that feels more coarse, or one that is, curly, while other hair is straight. So they look for a particular hair and then they're, focused on it and pulling it out. I once saw a patient who presented for treatment. They had seen a number of medical professionals because she had bald spots on her head, and nobody was sure why. She wasn't sure why, and her parents weren't sure why. And we ended up finding out that one day her mom moved her bed and found huge amounts of hair on the floor behind her bed. So she was doing automatic pulling when she was in that state that's kind of between awake and asleep, and she didn't have the awareness that she was doing it, and it resulted in a lot of hair loss and a lot of distress for her. But once we figured that out, we were able to really get her on a good treatment plan. Something that sometimes occurs with people with hair pulling is something called a trichobezoar, and that term is kind of, an odd sort of term, but what it means is that you find hair that is undigested that's in the digestive tract. So some people with hair pulling eat their hair, and you can't digest hair, so it gets stuck and it can be a serious medical problem. So if there's ever a time that an individual is pulling their hair and somebody observes them eat the hair, even if they put the hair in their mouth and they sort of play with it sometimes, we would suggest getting a referral to, the medical doctor and having a scan done to check out whether there is hair in the digestive tract. If a child puts a hair in their mouth, you don't really think like, oh gosh, are they doing this like 100 times a day, and that we can't digest hair. So cognitive behavioral therapy, or CBT, is an overarching type of therapy that has to do with trying to understand the cognitions or thoughts that the person is having and the behaviors that are kind of maintaining the symptoms. And then underneath that umbrella of cognitive behavioral therapy, there are many different types. One that has been researched a lot for body-focused repetitive behaviors is habit reversal training, or HRT. Within HRT, there are a few therapeutic approaches. One is awareness training. In the beginning, we do try to raise their awareness about when it's happening and if there are certain high-risk times, because that's going to really help us treat it. Another part of the therapy is something called competing responses. So we want to determine for the child or the individual, what else could they do with their hands during these high-risk times that would compete with their ability to pull their hair or pick their skin. So an example we've done with a lot of younger children is if a high-risk time is, watching TV and automatic pulling is occurring on the couch, we would have a basket of fidgets by the couch. And we would work with the parents to kindly encourage the child to pick up a fidget before they start watching TV, and then really reinforce them and reward them for replacing the pulling or picking with the fidgets. People that feel kind of a tingle or an urge to pull, maybe they just make their fists really tight at that time, and that's competing with them putting their hand up to their head and pulling their hair. Other competing responses are, some people will say they really like that feeling of when you're pulling something, the way that it feels, or picking something. So we try to replicate that with something that won't, hurt them or damage their skin or hair. So some patients have wanted to put like a hairband around their wrist and pick at the hairband during the day as a competing response to picking their skin or pulling their hair. Another part of habit reversal training is something called stimulus control. So this means you're doing something that more so completely prevents them from doing the picking or pulling. So with hair pulling, sometimes we have kids wear a hat during a high-risk time. So they go to put their hand up to pull and it gets blocked by the hat. I've worked with a teenager before that didn't need glasses. She had, perfect vision, but she asked to have glasses with no prescription in them because it would block her ability to pull her eyelashes out during school. So stimulus control also includes, for both hair pulling and skin picking, sometimes putting Band-Aids on their thumb and fingers. Often you can narrow it down. You can find out with an individual what do they only pick with their dominant hand? Do they only use their pointer finger and thumb? And if you can narrow it down that much, you really just need to cover those, those two, so that you can have stimulus control. I think hair pulling in particular is under-recognized because people, even young children, tend to find ways to cover up the hair, the spots where the hair has been pulled. So I've worked with kids who will only pull from the kind of underside of their hair near their neck because that's not as obvious, especially if they might have longer hair, or they pull from a spot that a headband could cover it and they ask to wear headbands every day. So I think that people in general probably don't know how common hair pulling is in the general public because of some of these strategies to cover it up. Skin picking, might be a little more obvious because people's hands tend to be visible, and that's often where it's occurring. But what I would want parents to know, the most important thing I would want them to know is that there are cognitive behavioral treatments available for this. So if you notice it and you see it and just think, oh, I just wish they'd stop, but it doesn't feel like there are options, there are strategies and options out there. Body-focused repetitive behaviors can relate to anxiety, but they don't have to. And that's really important because a lot of people think if a child is doing this, they must be anxious. And that's not always the case. There are just kids who seem to really need to move. We do see this more commonly in children with ADHD, but even without ADHD, they're just people that don't feel as comfortable sitting still. So this is one way where that movement can occur. But it's not always related to anxiety, but it can be. All of us parents are probably victims of just telling our kids, stop doing that, like don't do that, and we get on them. That's not particularly helpful in this case because they're often not wanting to do it, or they feel distressed by it, or they're concerned too, but they haven't found a way to stop yet. Or replace the behavior. So on the other side would be really reinforcing them for using the strategies. If you catch them picking up a fidget before watching TV, you say, you give them praise for that, or possibly give them a reward for that. So we want to stay what we call neutral to the behavior, and that we try not to put a negative focus on it, and we try to just reinforce the effort to use the replacement strategies. Usually the parents feel some distress about it. Young children might not feel distressed. They could have big patches of hair missing and not really feel like that's a problem for them. But parents might, notice it and wonder what's going on and feel concerned. So, parents have great instincts about their children and when they feel like something isn't quite right with their children. And so if they notice something that seems concerning to them, that's definitely something that they could bring up with their medical professionals.